If you are breastfeeding and have been diagnosed with mastitis by your doctor, you may want to know more about this condition. So let's talk about it. Hi, my name is Dr. Tasha, and I'm here to talk about health in general and breast health specifically. Today, I'm going to talk about the condition called mastitis in the context of someone who is breastfeeding. So, what is mastitis? Mastitis is inflammation of the breast tissue with or without infection. It can be considered as a continuum of disease, from non-infective inflammation of the breast to infection, which, if left untreated, may lead to abscess formation. The World Health Organization recommends breastfeeding for at least 6 months, and mastitis is not an uncommon complication of breastfeeding. It is estimated that it may occur in anything between 5 to 10% of women who breastfeed. And it can be an issue because it can be painful and uncomfortable and may stop mothers from breastfeeding their babies for longer than they would have liked to. So what causes mastitis? Well, this is a difficult question to answer because there may be several factors. Non-infective mastitis may be due to blocked milk ducts, breasts being too full of milk, contributing to milk stasis. Infective mastitis may be due to cracked nipples, which provide a route for bacteria to enter the breast. The nipple integrity may also be affected if there are difficulties in the baby latching. How does mastitis present? Well, the breast may look red and feel warm, engorged and uncomfortable. And if the infection is quite significant, you may also feel unwell and even have a fever with it. Other things you can do to prevent it from happening? Well, a Cochrane review published in 2020 tried to answer this exact question. It aimed to assess the effectiveness of different strategies that have been used to prevent breastfeeding women from developing mastitis. The review looked at randomized controlled trials, quasi-randomized controlled trials, and trials reported in abstract form. They included 10 trials, and ultimately 9 trials were analysed, and this encompassed around 2,395 women. And they found that acupoint massage is probably better than routine care. Probiotics may be better than placebo, although the evidence is of low certainty, and that breast massage and low-frequency pulse may be better than routine care for preventing mastitis. However, the review concluded that in general, they could not be sure what the most effective treatments are for preventing mastitis because the certainty of evidence is low due to the risk of bias and the low number of women participating in the trials. In addition, the large differences between the strategies made it difficult to make meaningful comparisons. Does that mean we can't do anything to prevent mastitis from happening? Managing mastitis involves a multifaceted approach, and there are certain things that may help. Firstly, it's crucial to ensure complete emptying of the breast during feeding or pumping. Gentle massage and proper positioning while breastfeeding or pumping can prevent milk stasis. And in some cases, antibiotics may be necessary to treat bacterial infections associated with mastitis. However, as always, consult a healthcare professional for guidance. The thing is, prevention is key. To minimize the risk of mastitis, maintain good breastfeeding hygiene, ensure proper latch and positioning, and avoid tight-fitting bras that may impede milk flow. Regular feeding or pumping also help in preventing milk stasis. I hope this is helpful, and I'll see you in the next one.